Good morning, everybody. It is a great morning here in the Commonwealth for our clinic today, where we will be providing necessary booster shots to continue our fight against COVID-19 and ensure everybody's immunity is at a level that protects them. Before we start, let's remember that we're not just battling for the lives and the health of our people, we're battling for our future because we have an economy on fire. And our ability to grab our place, to stake our claim as a leader in the post-COVID economy, depends on us getting through this pandemic and putting it in the rearview mirror. Our tremendous economic growth continues. Just yesterday, we announced another 350 new jobs for Kentuckians. One was Helpware, a Kentucky-based digital customer service company, adding 300 jobs in Mount Sterling and Harrodsburg. The other is Inoac Group North America LLC in Springfield with 49 new jobs, $13.7 million in investment. Every day we see more opportunity, better jobs, a chance at a better life, and for this state to be something so special. Never a flyover state again. Today is part of how we get there. So the exciting news today is this booster event is sold out. Every single spot that we had, every single booster shot is taken. That means that people are getting the message, over 200 of them today, that the booster is necessary and that waning immunity is real. We want to encourage other healthcare providers to set up similar types of clinics. The fact that today's is sold out shows if you can do it in a convenient place, especially near work, we can get more people boosted faster. Remember, the CDC has approved booster shots of Pfizer, Moderna, and J&J for most of the population. Some studies suggest 80% of people out there, certainly over 18, will qualify for a booster. And the reason we need it is every month that goes by, we have more breakthrough cases, hospitalizations, and negative outcomes. That's because people's level of immunity drops over time, and the Delta variant is more aggressive. So, to keep yourself protected, get that booster, and we believe we can get your immunity up as effective as we were against the Alpha variant when we were first doing these vaccines. Remember that you can get a booster if it's been 6 months since you received the second original dose, you're 65 years or older, you have underlying health conditions, or you work a job that exposes you to the public. The rule for J&J is anybody who got J&J can and should go get a booster as quickly as possible. And you can mix and match. You should talk to your doctor about that. Especially, I would suggest if you got J&J, you might want to consider getting another vaccine. Remember, you can visit kycovid19.ky.gov to find out where you can get your booster. Also remember, kids 5 to 11 now qualify. This is the first full week you can get your kids vaccinated. My daughter has now gotten her first shot. Today, we got a group of great leaders that have agreed to get vaccinated or to get boosted. Our Lieutenant Governor will get her booster today. Rocky will get his booster. We've got Senator Givens, who has come to get his booster today. We appreciate that. And Justice Van Meter is now boosted, and we appreciate it. So all three branches of government, people of all parties, just doing the right thing. With that, let me turn it over to Dr. Stack, who will be followed by the Lieutenant Governor, and then we'll put a couple shots in arms. We also have Lieutenant Governor's husband, Chris O'Brien, who tells me he's going to be very brave in getting his shot.
Thank you very much, Governor Beshear. Good morning, everyone. I just want to emphasize what the governor has said. If you think back to this past summer, just remember how wonderful it felt for a seemingly fleeting moment in time. When the weather was good, people were outdoors, people were going back to restaurants, we didn't have masks, the formal guidance was able to remove those recommendations. Just remember how nice it was to get back to the lives we used to know before this virus disrupted things so much. These vaccines are the way we get back there. Prior to the Delta variant, those vaccines, the ones that we're offering now and getting boosters for, were so protective, it effectively prevented you from getting harmed from it almost entirely and almost prevented most people from spreading the disease at all. If we get boosted, if we get all vaccinated, that's how we get back to that place. So now I want to encourage you all. Remember, the governor just said if you're 65 and older, that's all you need. You go get your booster. As long as it was 6 months ago you had your first dose. If you're 50 and older and have any medical problems of any sort, go get your booster. If you're 18 and older and you work in a setting where you're high risk exposure, and or if you have any medical problems, go get your booster. I want to ask your patience a little bit. I hear some stories, and we'll keep working through this to try to get this right. You get to attest when you go to get your vaccine that those conditions apply to you. So if you feel you meet one of those criteria, you should answer in good faith that those criteria apply to you and you're eligible for a booster. And like the governor said, if you're one of the 7 million or so people who've gotten, 7 million doses of J&J, I think we're given, or 7% of our total doses were J&J. If you're one of those folks, all of you, probably all of you who have had a dose 2 months or more ago are eligible. You don't have any other qualification you need. If you got J&J more than 2 months previously, please go get a booster. The last thing I'll share is we've got to come together to work against this misinformation virus that's out there about the vaccines and about the virus, and come together to build a protective ring of community immunity against that misinformation. The vaccines are incredibly safe, incredibly effective. It's how we get back to our lives and keep our friends, our family, and our loved ones safe. I want to thank the governor and all the others in state government and in public health who have worked so hard to try to make this available for folks across the entire state. And I want to specifically thank the Franklin County Health Department who's here today doing this event in the Rotunda. Their role as the capital's public health department has brought with it an incredible amount of extra work over this entire journey, and I think they have really done public health proud. And so I want to thank Judy Mattingly, the public health director, Michelle, and the many others from the team who have done so much to help support the governor and the executive branch and all of the people of Kentucky by keeping our capital operating and safe and well. So thank you very much, and thank you, Governor.
This is Coach O'Brien.
She's fast. All right. Well, thank you so much, Governor Beshear, to Dr. Stack, to all of the healthcare heroes who work at the Franklin County Health Department. Thank you for helping to keep us safe. We really appreciate it. And there's been a lot of talk around the boosters and efficacy and a lot of data and science that we've been sharing over the last 2 years. But at the end of the day, I think it's really important to get to the heart of why we're doing this, why we got vaccinated in the first place, and why we are taking the booster shot today. And for me, I'm taking it because I want to protect the most vulnerable people. And in my case, in my household, that involves my 21-month-old daughter, Evelyn. Our 3 older kids have all been vaccinated and will be boosted as soon as they can. And that leaves us with one who is 21 months old, who is not yet cleared to get the vaccine. And that little member of Team Kentucky means a whole lot to us. And so if this means, sitting here and taking this booster, if this means that we're going to be less likely to contract and transfer the virus to an unprotected toddler, then this is a really simple thing to do at the end of the day. So it's really important that we remember there are still thousands of kids across the Commonwealth who cannot yet be vaccinated and certainly haven't been able to get a booster yet. And so, like so many other parents out there, I am counting the days until we get the green light to take Evelyn to the doctor so that she can be vaccinated and be protected against this virus. On the other side of the coin, I have a really good friend who is a physician in a pediatric intensive care unit here in Kentucky. And she talks a lot about the kids that she works with every day, the families that sit with those kids every day. They may have to have breathing treatments. Some have been on ventilators. And I try to put myself in those family shoes and think about what it would do if to me, if that's the situation that I was in with our little daughter Evelyn, who is just as happy-go-lucky as they come. I can't imagine being in a hospital with her like that. And so everything that we can do to prevent that from happening is exactly what we're going to do. And so, at the end of the day, this virus is here. It does not discriminate. It does not care about your zip code, your income, your skin color, your gender, anything like that. It is going to, it's airborne, and it's going to be a challenge for us. And no one is safe from it unless you get vaccinated and take the right precautions. And so for myself as an elected leader, as someone who's taught in Kentucky schools for over a decade, as a mother, as a wife, it's really the least that we can do to protect all of our citizens and all of our family members, especially the folks who are the most vulnerable among us. And so my message to Team Kentucky is very simple. Make sure that you get your vaccine when you can, get boosted as soon as you are eligible, and continue being really good teammates on Team Kentucky. And I want to say thank you again, Governor, for allowing us to be able to do this here today. Thank you.
We'll take any questions that you have. Tom, who is getting boosted today? Mm-hmm. All right, so the question is, we didn't know that we would necessarily need a booster when we were getting vaccinated. Is this something we should expect going forward? And the honest answer is no one knows. It is a brand new virus. It did not exist until it hit us and this world so hard. The once-in-a-century viruses, pandemics, have acted differently than each other. Some of them we still get a vaccine for or give a vaccine to children for, some of which are gone and we have not seen. I just think that we are blessed that we have the science, the technology, the ability in a year to create an effective vaccine, and then to realize that we need to boost it and be able to do that. We now have the method of getting millions of people and even hundreds of millions of people vaccinated and then boosted. We're living through a tough time, but we have a better chance, regardless of what this virus does, of responding and responding well than any other generation in history. And so it's on us to do so. But also we have to stay humble enough to say we don't know for sure what the virus is going to do next. We have to be prepared for what it could do. So this is a clinic intended for people to get boosted. I believe they have the ability if people want to get vaccinated for the first time or to get their second shot. But today's goal was to keep people's immunity up, and I believe that's just about every sign up that we had. And so I do think it shows that people are looking for easy options to get boosted. And so again, I think clinics at work, at church, at other places are good ideas. I believe that we have reached a huge amount of people for the first shots. We obviously need more. Our percentages are highest for our oldest Kentuckians, which is, I mean, we're going to hit 90, we hope 90% soon, we hope, on the oldest Kentuckians, and we're over 90 on that second group. That is the most vulnerable group, so we are blessed to have hit those numbers. It's certainly as you get younger that we need more shots in arms. We are seeing every day, we see 30-year-olds passing away, and that age group isn't signing up enough. We lost an 11-year-old on yesterday's report. So while that is rare, nobody wants it to be their 11-year-old. I have an 11-year-old, and it's a good reason to get those kids signed up too.
Pfizer specifically, I think things are getting a little confusing for people when it comes to boosters. What is the easiest way people can figure out, do I need to get a booster, do I
Right.
not, am I qualified, am I not?
So in my opinion, everybody needs a booster, and I'm hoping that the federal government moves to that very soon. 6 months after getting your first shot, I believe everybody should be able to get a booster because waning immunity is real, and we want to lessen the spread as well as just protect the most vulnerable. But the easiest way is 3 different things right now. Number 1, if you're over 65, you qualify, you really need to get it. Number 2, if you have an underlying health condition, with waning immunity, you're more at risk. You need to go get it. But number 3, if you are one of almost the 80% of us that has a job where we see the public a lot, the media, what we do, so many others, then you qualify and you need to get it. It really is that simple. Just make sure if you qualify under those, when you go in, that you're ready to answer the questions that way. I do know Pfizer has now asked the FDA, the CDC, to open it up for everyone. I support that ask. I think that is what's going to help us, especially as we move into the winter, as we have holidays, to be protected and to not see the same type of surge we did last year. Great. Thank you all very much.